people, it's me Angie. I hope you are having an amazing day wherever you are. As requested, this video is on volunteering and work experience to go into a healthcare profession. I'm going to refer to medicine because that's the direction I'm interested in. But essentially in this video I'm going to break down different types of work experience, give a few examples because I know there are so many incredibly niche work experience examples and I can't possibly cover all of them here. That goes with so many other things. For example, I mentioned supracurricular in another video that I think has already come out. It might come out after this. And supracurricular is so wide because it could be an online course, or like me, I told you guys I'm doing my human genetics summer camp. Like, that's very, very niche. So we're keeping it general and we are starting off with the most obvious one. Hospital work experience. If you don't know how to get a placement, where to look, or the type of paperwork you might be faced with, click above my head. I will leave a link to my hospital work experience video. You guys voted for me to make a video on things that you might not know, for example, naked below the elbow, little things I've picked up because I'm kind of collecting placements like infinity stones at this point. So I'll get to that and that will come out pretty soon. So when I talk about a hospital, this could be any kind of specific ward. So it could be geriatric, it could be oncology, it could be obstetrics. I would say don't limit yourself and think, I'm going to become this one thing. You're not even in med school yet, babes. Relax.
I have to laugh.
I know that's very hypocritical because I know where I want to go. But things change. So go wherever you can get, and regardless, you're still going to have the same principles behind it. I've done placements in obstetrics, gynecology, neonates, general surgery, and through all those different places, the principles of medical ethics, all those different things, I've still learnt them there. I've had friends who have done placements in cardiology or in different places like that, and they've still gotten the same principles. So try not to be too picky. There are some places that you might not be allowed. I know when it comes to like the mortuary, postmortems, all of that, they're a bit more. Why is a small child trying to get here? But in general, click the other video to learn more about that. So other than a hospital, the next type of work experience that you might need is in a general practice. In a hospital, that shows that you can deal with the demands of medicine, but here we're looking more at the fact that you can interact with people. In a GP, there's a lot more, it's more personalized, so you need to be able to sit in a clinic and understand this is an individual patient and I can understand these things from them, and that is a really great thing because I know me being in clinic versus when I was in theatre are two completely different things. So it's important that if you can, you get those different sides of the spectrum. The next type of work experience is in a lab, which might sound strange because I'm not a biomedical scientist, I'm going to be a doctor. Relax. When you study medicine, of course, if you look at the different types of courses, it will be different in different places. There's a level of science behind it, and if you can get a placement in a lab, I did some time in a sperm lab, IVF stuff. That was interesting. I was just watching them like... They were just running around and stuff. It was the weirdest thing because they were just so agitated. I digress. Yeah, it shows that you can have certain clinical skills, that you understand different types of aspects that you might be in. For example, if you go into research rather than practicing down the line. But it also, if they ask you why medicine, why not biomedical sciences or pharmacy or this or that, you can say, well, I have done this, I learnt this, and I'm moving on with this. You see where I'm going? Okay, so the next type of work experience you could do is in a care home. Got the care home down the road. Lovely, lovely people. But this shows a different side of you. You can show more compassion here, more empathy. In a care home, you might have people who are really lonely. And with an aging population, showing that you can deal with elderly people and that you have experience in this, that's a really great thing for you to have under your belt. The next type of work experience placement that you might want to consider is something in a hospice. I say hospice, but any kind of high pressure, lots of bad news environment shows that you genuinely understand the emotional demand. So I did my placement on NICU, and that was definitely a lot because not only is it dying people because it's intensive care unit, it's dying premature babies, and that's a different it's a different kettle of fish. Is that what people say? I don't know idioms and I try to use them, so please forgive me. But having experience in oncology, palliative care, ICU, care, hospice, this shows that you can really deal with the negative part of medicine. And as a doctor, you want your patient to be amazing and go climb a mountain and live their best life when they're done and they're healed. But sometimes that doesn't always happen, so you can reflect on this time, and it can also help you decide whether you want to be in medicine or any other kind of health career like that. So the next thing outside of those types of placements is volunteering. So when you're volunteering, to be honest, you can link anything to medicine, dentistry, physiotherapy, however you want to do it. And what you'll find is that your regional charities will be very different depending on where you are, so that helps you to stand out and be unique. So whether you choose to go and do something with young children, I know I had an amazing time in a nursery with special children. It was like both sides of the spectrum, so like there were the special needs children, but also the gifted and talented kids, and one of them was 4, she was speaking bare languages. I said, that's my girl. Like, we are the same. I love, like, it was such a good time. But it could also be in a charity shop. A charity shop is a great place to consider. You could also do something in first aid. That's great. It shows that you have these actionable skills. You can work under pressure. This could even link to things like being a lifeguard, for example, because you're still under pressure. You still have your first aid skills. It's a different environment. There are so many different things. I think as much as you guys want me to give you a list, and in the description I will genuinely list a bunch of different things, you need to understand that, especially with the current pandemic, and if you're watching this in the future, especially because of the competitive nature of getting these placements and how hard and how long it takes. I know my local hospital just there, their waiting list to get a placement is like 9 months, so it can be hard. You need to try and just work with what you've got. At the end of the day, that's how it's going to be. You got your placement at the Donkey Sanctuary. That showed you the importance of a holistic approach to healthcare, because you saw how happy people were when they saw the donkeys, and that has a positive impact on their mental health. See, you have to be able to link things. You know how like English teachers, they'll just bring two things together. The full stop shows the pain. That's what you need to do to some extent. But I hope this video helps to guide you when you're looking for different types of placements. And as always, make sure you wonderful people smile, subscribe, study hard, slay hard, and I will see you again very soon. Bye.